Hi guys, welcome to my YouTube channel, Health with Esther. My name is Esther and I'm a pharmacist. On this channel, I'll be talking about women's health, fitness, and everything in between. If this is the kind of content you enjoy, then you are in the right place. Please subscribe because I'll be bringing new content your way every week and you won't want to miss it. Stay tuned. In today's video, we'll be talking about how to take care of the vulva and in extension, the vagina. But before we get into the video proper, I would like to address one misconception. This is not the vagina. So the part of your reproductive organ that you can see between your legs is actually not called the vagina, it's called the vulva. And the vulva includes the urethral opening, the vagina opening, the clitoris, the labia minora, and the labia majora. So let's get into the video. The first and most simple method of taking care of the vulva is by washing. Would always advise that you wash with just water, but in case you're not comfortable with washing with just water, you can use soap and water. But please make sure not to use scented soap or medicated soap. Now, the vagina has a pH of between 3 to 5.0. That's it's quite acidic. So when you use medicated soap or scented soap, it can alter the pH of the vagina, and this can lead to growth of unwanted bacteria, which will then lead to an infection. So even if you want to use soap, try to get the unscented soap and use it with water. So I'll be looking down because I made some points and I don't want to forget them. So it's not just about washing your vulva. How you wash your vulva is also very important. We advise that you wash from the front to the back, that's from the vulva to the anus, and not the other way around. Because when you wash from the anus to the vulva, there is a high chance that you transfer bacteria from the anus into the vagina or even into the urethra, and this can lead to an infection. Sometimes when I see young patients, like when parents bring their daughters of less than 10, less than 5, people that can't really express themselves. And then the mother is saying something like, oh, my child is having smelling discharge, or when I remove her panties, there's this awful smell that comes out. The first question I will ask is, okay, has this child been abused? And if the child has not been abused, then the next thing is obviously the hygiene of the child. So, of course, would always link that kind of infection to how the child has been cleaning their vulva. There's a possibility that they've been cleaning the vulva the wrong way, and then bacteria has gone from the anus into the vagina, and that's what's causing the smelling discharge and maybe sometimes itching too. So throughout this process, I've been teaching you on how to wash your vulva. I didn't for once mention washing the vagina. Please, the vagina is a self-cleaning organ. It cleans itself. It doesn't need your help to clean. So there's no need for you to put your hand into your vagina to try to wash it. You can't wash it. It is self-cleaning. The only reason why you should be putting anything into your vagina is for pleasure and for treatment. That's all, nothing else. And make sure whatever you're putting into your vagina is clean, because bacteria can be transferred from anything and anywhere. So please, please, please do not wash your vagina. And the process of washing your vagina is called douching. We don't want that. There is no advantage you get from douching, that's from washing your vagina. So please do not wash your vagina. Only wash your vulva, and wash with water or water and unscented soap. So the next point is wearing breathable underwear. We would always advise ladies to go for cotton materials because it allows air to pass through. But materials like nylon and polyester do not allow air to pass through. And this can support the accumulation of moisture. That is, when you wear thicker materials, suppose the accumulation of moisture, and also there's increased heat, and this would increase the growth of fungi, and that's one of the things that we don't want. So when selecting the kind of underwear to use, always go for softer materials, cotton, so that it would aid air to pass through. Also, apart from increasing the growth of fungi, it can also cause rash, chaffing from sweating, and other discomforts that come from wearing tight underwear. The next point is eating a healthy diet. So we can never overemphasize the importance of eating healthy. This plays a major role in your overall well-being, your heart health, the liver, the kidney, and also the health of the vagina. Foods like cranberry have been shown to improve the health of the urinary tract. Yogurt contains prebiotics that we need for the growth of the good bacteria that we need in the vagina. Pineapple, which is a good source of vitamin C, and vitamin C helps with the elasticity of the vagina. Vitamin E also helps with increased blood flow to the vagina, and vitamin E can be found in foods like avocado. Zinc, which helps with which helps to improve the immune system, and zinc can be found as a supplement. Then omega-3 fatty acids are very, very important for the health of the vagina, and they can be found in foods like avocado and fatty fish. Now, all the things I've mentioned can only be found in whole food, fruits and vegetable, which means that in our diet we should try to increase how much fruit and vegetables we consume, and also whole foods, and we should try to cut down on added sugar and highly refined food. Apart from healthy food improving the health of the vagina, it also improves your general health. And also, too much added sugar has been linked to increased yeast infection. Science has shown that diabetic patients come down with yeast infections more than non-diabetic patients, and that's because the sugar in their blood is high. So when you consume added sugar and a lot of refined food, it can lead to increased sugar level, and which can also lead to yeast infection. So let's take note of our diet and improve it so as to improve our general health. The next point is practicing safe sex. So having unprotected sex increases your chances of contracting STIs, that's sexually transmitted infections like gonorrhea, syphilis, HPV, chlamydia, and even HIV. So we'd always advise that we practice safe sex. Apart from practicing safe sex, once you are sexually active, it is advised that that's you and your partner go for regular STI screening, because these infections are easier to treat when they are caught on time. The next point is seeking medical attention. So immediately you notice that there's a change in the color of your discharge or a change in the smell of your discharge, please, please, please go to a medical practitioner immediately. Don't wait. Like I said earlier, the faster we start treating these infections, the better, and then the easier it is to treat. So please, once you notice that there's a change in how you feel down there, please go and see a medical practitioner. And when your pharmacist or your doctor tells you to go and run a test, it's not because they want to waste your money, or it's not because they don't know the drug to prescribe to you. It's just because we want to be sure. There are a lot of organisms that cause a lot of infections, and sometimes these infections have similar symptoms. So instead of doing guesswork, they just say, okay, go for a test. This test tells us the particular type of infection you are having and then the exact kind of drugs to use. You are not just wasting your time and your money. And also, like I mentioned earlier, regular check-ins. Once you are sexually active, go for regular STI screening. The earlier, the better. And also for people that have had HPV, it's also important that you go for a pap smear. Come to the end of this video. I hope you learned something. If you have any questions, leave it in the comments section. Please do not forget to subscribe, like this video, and share it. Till I come your way next week. Bye.